Welcome to Mental Health Momentum, a Silicon Slopes podcast. I'm Dr. David Morgan. I'm your host and a licensed psychologist and the director of mental health awareness here at Silicon Slopes. And on this podcast, we talk about the issues of mental health issues that affect businesses and look for solutions as well. Today, I'd like to introduce my guests, Kari Norton and Heidi Strickland, both of the Utah Wellness Worksite Council. Kari first. Kari is a Worksite Wellness Program Coordinator at Utah County Government. She has coordinated the Employee Wellness Program for over 900 staff members since 2011. She holds a bachelor's degree in public health, a master's degree in public administration, and certifications as a health education specialist and a worksite wellness specialist. Her mission is to create healthier and happier workplace culture by promoting and incorporating total well-being strategies into programming and implementation. Kari is currently serving as the chair of the Utah Worksite Wellness Council, whose mission is to support organizations throughout the state in improving the health and safety of their employees by building and maintaining effective holistic programs for their employees. She lives in American Fork with her husband and son and loves traveling, gardening, cooking, reading, hiking, and going to exercise classes at the gym in her free time. In your free time, right?
Yes.
Heidi Strickland is a wellness manager with Aetna. In her role, Heidi strategically develops, implements, and evaluates programs and projects for organizations and determines the best wellness solution for their demographic. She lends wellness support to clients, brokers, vendors, and the client solution team. Her key areas of expertise include employee engagement, workplace culture, resource integration, long-term wellness, strategy, risk mitigation, and holistic well-being. Heidi has over 15 years of experience in well-being and engagement. She earned a bachelor's degree in exercise science with a minor in nutrition from the University of Utah and currently volunteers with the nonprofit organization Utah Worksite Wellness Council. In her free time, she loves planning over-the-top parties. We'll need to hear more about that. Doing do-yourself projects and spending time outdoors with her husband Josh and her two children and 2 dogs. Kari and Heidi, welcome to the podcast. Thank you so much for coming.
Having us.
Very glad to have you here. Okay, over-the-top parties. Tell me about that. Heidi, what does that mean?
Yeah, so when my son turned 1, he's 14. I started planning over-the-top parties, thinking about every little detail, and I really just thrive off a theme. You know, give me a theme, and I will think about every detail and think about from start to finish and what that looks like. So I really enjoy the stress and chaos and what the end result looks like.
Has he continued to have over-the-top parties for the 14 years?
He has.
Okay.
This last year was the first year he did not have a party. He wanted more money towards his dirt bike, and that was heartbreaking for me, but my daughter turned 11 and we made up for it.
We had some friends years ago, and one of the mom's favorite things to do was to make her daughter's hair into all these fancy things, all these braids and all these over-the-top things. And she wept when her daughter said, "Mom, I'm too old for you to do my hair like that anymore."
It's definitely sad. So if anyone would like me to help with their parties,
That's right.
I'm happy to do that.
Heidi's available for hire for over-the-top parties. So, and then Kari, so all these things, traveling, gardening, cooking. So do you have a favorite among all of those?
Traveling. I don't get to do as much as I used to, but I actually just got back from Scotland last week. So I do really enjoy traveling.
Oh, that's amazing.
Yeah.
How was it?
Yeah, it was great.
Was that your first time there?
No, I've been there a couple times, but we had just perfect weather. So it was just walking around all day, looking at all the history, and it was amazing. So
it's so important, I think, just to kind of get out of our own bubbles, right? And just see what's out there. I think that's one of the things that sometimes even impacts our mental health is just, and our views of mental health is we just view everything through our own lens. And then we assume a lot of things about that. But once you can kind of experience things, you don't have to go to Scotland to do that, but even just getting to know different types of people or different cultures in that, it can make a huge difference. So
definitely, yes.
Okay. Tell me about the Worksite Wellness Council. So how long has that been around? What's the focus? What does it do?
Yeah, so the Utah Worksite Wellness Council, we're a nonprofit organization. We've actually been around for over 40 years. We originated as part of the Utah State Health Department and have put on an annual conference for about 40 years to help bring awareness and topics for HR and wellness professionals. And in 2008, with budgetary cuts, we became our own entity and really rebranded. and became kind of our own organization that we had control over before there was a lot of, red tape with being a part of the state. And we have evolved into putting on an annual conference. We put on wellness workshops, really spotlighting great things that employers are doing in the state of Utah. We put on networking events as well as mental health workshops and seminars, and really just strive to help bring HR and wellness people together. We're all in our own silos sometimes, and so we really provide tools and resources to help support putting on worksite wellness programs.
So you're not part of Utah County, or you are part of Utah County? You're not?
No, we're not.
Okay.
No.
Okay.
We're our own organization.
Okay.
So.
Yeah, we are all volunteers. There's not one paid person on our council. We have about 25 members right now. It ebbs and flows, but we all have jobs outside of the organization and put on some really awesome events in the community.
You mentioned it had been around for 40 years. Was there, and I'm guessing that 40 years ago, the emphasis on mental health was probably pretty low, if any, right? I mean, wellness in the workplace was probably more like physical health,
It was absolutely
stop smoking,
physical health.
stuff like that, get moving. When did mental health become more of a focus, or not a focus, but more kind of an element of it?
Yeah, I've been a member of the council since about 2011, so probably one of the longest standing on our organization. And we really tried to focus on different areas of health and well-being at our conference, and different breakouts and topics and sessions, but it really was physical focused, nutrition focused. And I think during COVID, we had to pivot to a virtual conference. We actually didn't do a conference in 2020, and we went to a hybrid event in 2021. And that's when we really found the need that we had to focus on giving additional tools and resources for mental health. We did things a little bit before that, one session here or there, but it really was not something that employers were asking for.
Are employers asking for it now?
Oh, yes, definitely.
So what kind of things, what are they noticing in their organizations that they need help with?
Just where to go for help. There's a lot of resources out there. We don't have to recreate the wheel. So, just what do I even do? Where do I start is what they want to know. And we can luckily help them with that.
Right.
I think, too, making sure that the leadership is bought into the idea, because you can have a great program and give it to your employees, say, hey, here's this program we give to you, but we're not going to allow you to access it on work time, or their middle managers are saying, no, you can't do that. And so really just making sure it's a cohesive message that coming from the top down, that this is something we value, we support you, and we really care about you. We're doing this for you, not against you or trying to penalize you for anything. And I think just having ongoing communication has been really exciting to see that it's becoming more accessible, and employers aren't feeling like there's shame around it. Right.
Well, and I think there has to be a shift there, because you've got, on the one hand, there's kind of this, what I think now is an antiquated idea that, any sort of unproductive time is lost time, and it's not going to help us. Where now we're kind of realizing we need to have a little bit of that in order to optimize our mental health. There needs to be some times where we can take breaks, and where we can disengage and set boundaries in the work setting and say, no, my pager is not going to be on 24 hours a day, 7 days a week. I'm going to be unavailable during these times so I can focus on whatever else I have going on in my life. And so I think for a time it was like, okay, well, we should have a mental health aspect to our work culture. But then if it's not followed up by actual implementation and by, like you said, by the leadership showing buy-in to that, then I think it kind of rings hollow with some of the employees.
Definitely. And there's still some managers out there that are like, oh, this is frou-frou. But, but there's a lot more that see the value and know that it will help them in their company as well.
Well, and I think as more people are affected by mental health, I think that either you've had an experience with a mental health issue, or you have a first-degree relation with someone who has had an experience with a mental health issue anymore. And that was different probably 50 years ago. Either it wasn't talked about as much, or maybe it just didn't happen as much. I don't know. But it's definitely happening more now. And I think businesses can't afford to just ignore it and say it's frou-frou. This is, you don't just grit your way through it. I don't know.
There are true hard costs too. not being able to focus and you might be at work, but are you actually present? And that's a word that's been in the worksite wellness world for a lot of years, but how do you prove presenteeism, absenteeism? I do think employers are seeing that if their employees are burnt out, they're not fully engaged, their work isn't great. And so they really need to recharge and give them the ability to rejuvenate. You know, like you said, traveling and event planning and self-care, those things matter. And if you aren't doing that for yourself, or you're not encouraging your employees to do that, there's going to be a negative consequence that takes place at some point. And it could be a catastrophic mental health event, or it could be something where they quit because they don't feel like they can do their job properly. So it will come and translate into dollars.
Exactly. It's the ounce of prevention sort of thing, right? Is worth a pound of cure. I mean, you're going to pay for it one way or the other.
Exactly.
You can pay up front a little bit, and all the things that come from that, right? You increase the well-being of your employees. They're happier. They have greater peace in their lives because of that. They appreciate what you've done for them in the work setting, and that's going to lead to loyal employees and people that want to be there, as opposed to you can pull everything out of them for as long as you can, and then they're going to quit. And then it costs a lot more to replace an employee than it does to retain an employee, for sure. I was going to ask about, because I was looking at the website, your website, and all of the people on your board are women. And I thought, that's amazing. Is that like no men allowed, or is it?
Definitely not.
Okay.
We have had men in the past.
Oh, okay.
Yeah, but it's a volunteer organization, and just more women tend to volunteer. So we welcome men as well.
Okay.
Yeah. And
absolutely,
you know, women are definitely more dominant in this industry. If you attend any of our events, it's usually about 90% women at the events. And I just don't think that men are in the healthcare wellness industry as much, or they're in higher up positions, more of the strategic side. So
maybe so. Yeah.
Do you want to join the council?
Yeah, exactly. Exactly. Well, now that I know it's not just women only, right?
It could be intimidating being with all females all the time.
You split off from county government or from state government, and like you said, that got rid of a lot of red tape, which is wonderful. Does government have a role in trying to promote wellness? I mean, is this something that just businesses should be worried about? Is there legislation that's needed? I mean, what are your thoughts on that? Because you've been on both sides, right? When it was part of government, now that it's not.
Yeah, I've worked in community health for 18, 19 years. So our role in community health at the local health departments is just to provide access to resources for the underserved population. So that's kind of our focus. But just making sure everyone is aware of the resources. There's so many great things out there, so many great groups doing amazing things. So just letting people know that they're available and they want to help.
When we were talking earlier, and you were saying, Kari, how a lot of times businesses will come to you just with their hands in the air saying help, right? Because they know what the problem is, but they don't know the solutions. And what you're saying is there are a lot of solutions out there ready to go, people who are willing to help with very likely the problem that business might have. But if they don't know about it, then so that's one of your jobs, is just to connect those people.
Yeah, connecting to resources. And there's all different kinds too. So there's like the Safe Utah app. So for people that don't want to talk to anyone, maybe that younger generation just wants to text, they can do that. There's counselors available for those that do want to talk to people. So lots of different options available too. So whatever works best for your population.
Right. We've mentioned that on the podcast before. It's Safe Utah.
Yeah.
Right.
Safe Utah.
Safe Utah. It's an app. It's amazing. It's mental health focused. It's specific to suicide prevention.
Yeah, I think it is. It's more if you are in crisis or you know of someone in crisis, you can identify anonymously.
Right. And that could be any sort of mental health crisis. It doesn't necessarily have to be a suicidal crisis, but it's
someone needing help.
Yeah, exactly. Yeah. But you said also that you could reach out to them and just say, hey, I'm looking for a counselor. Is that something you guys could help with? Is that?
Yeah. United Way also has, I think it's 211. You can text them and they've got a whole list of resources. They'll find whatever you need and give you that information. So you don't even have to do the searching by yourself. It's great.
And that's particularly important now because since COVID, there has been a huge demand for mental health services, and the supply of mental health professionals has completely, the demand has completely eclipsed the supply. And so I get people all the time as psychologists, they'll message me and say, hey, do you know anyone who's taking new clients? And I'm like, get in with anyone that you can right now, because it's hard to find providers right now.
I work for a health insurance company, and since COVID, the last 4 years, we've expanded our network about 380,000 behavioral health professionals nationwide. And because it was taking months to get into a actual brick and mortar facility, we have expanded to offering a lot of virtual care. There's many virtual providers out there. Talk therapy, chat therapy, video conferencing. There's so many more modalities. There's even, a lot of employers offer employee assistance programs that no one knows about. There's usually about a 1% utilization rate, and it's unfortunate because these sessions are free. They are free to the employee. They're free to the family members. You can typically, get into them if you're in crisis within minutes, hours. If you can triage and go down, and wait a few days, you can get in, within a week or two over the phone and at least get a little bit of information and insight. And then it in our network, it transfers over about 98% to the medical plan. So you wouldn't have to change providers and restart your story and, go through all the trauma again. So really look into what your employer is offering. And if you're not an employer offering an employee assistance program, you should be. You should be, yeah. So, I mean, and not only is it that's available, a lot of those EAP programs offer on-site intervention if you have a crisis at work, suicide prevention. If you have someone that died by suicide, they can come in and talk. Also, they can do different sessions on stress and anxiety, burnout. So those are all things that are included that you're already paying for. So take advantage of it if you are an employer with that program.
Why do you think there's such low utilization rates?
I just think everyone is burnt out with communication. They don't know what it is, and they don't access it until they're in the thick of dire need. In the moment of trauma, grief, whatever it may be, they have no idea where to go. And so it's just one more thing they have to do. It's overwhelming. And so I think that's part of it. I think the people implementing it aren't doing a good job of rolling it out and explaining how to utilize it, how to access it. And it needs to be present on every platform that employee touches every day, on your intranet, on your benefits site, so that when you are ready for it, it's easy to find. If you have to create another username and password to access it, you're not going to do it, because I will tell you, I will forget the password and I'll just give up. So I think that's part of it. And also trying to touch people in their hard moments. If they've had a baby, if they've had a death in the family, send them a postcard or send them the information. If they need it, it's readily available and they don't have to go digging for it. And really, those people that are in the thick of it, they'll appreciate it down the road.
Right. Well, yeah, I love that idea of the information needs to be kind of present and ongoing, right? Not the type of thing that every May during Mental Health Awareness Month, they get one email about their...
just during employee benefit enrollment.
Yeah, exactly, which could be once in 20 years, right? If they, if they've been with the company for a long time. Because in those moments when the person is in crisis or not even crisis, but is struggling significantly with a mental health issue, that's when they need immediate access to that. It needs to be the type of thing where they go, oh, that the last time they heard about it was 2 weeks ago, or the last time they saw something about it or whatever. And I guess you don't want to be overwhelming with that in your business, but at the same time, it needs to be something that's talked about regularly. And like you said, that every employee should be able to explain to you in about 3 minutes how to access their EAP, right?
And I think maybe offering some trainings for your managers that are having more of those connections. You might be in a very large organization and can't do individual employee meetings, but your managers talk with those employees frequently. They understand their emotions, how they're feeling. Are they acting weird? Are they not showing up for work? They can really identify if they might be struggling, and they could be a good resource to share with them. Hey, I don't know if you are aware of these benefits. These are available. And I think they can kind of bridge the gap sometimes.
And there may be a decent chance the manager doesn't know.
They probably don't.
Exactly, right? And so at the very least, managers need to be extremely familiar with those programs and systems and what's available.
Exactly.
Yeah. 100%. How do you start? I mean, like we were saying, part of the problem is that mental health issues can just get so large so quick, and then we're depleted emotionally when they happen. So what can people do? Like, what advice would you have? Kari, what advice would you have just to some individual who says, look, I want to help with something in mental health, but I don't know where to start? What would you suggest?
I would echo Heidi's sentiment and EAPs. If you have EAPs, make sure they're being utilized. Make sure people know about those resources, because I've never talked to an employee who did not have a good experience with the EAP. Mm-hmm. It's just making that initial phone call and appointment. So that's a great place to start, because you probably already have it if you have EAP. If not, look into it. They're very low cost, very user friendly for your organization. So.
And that's something I don't even know. Are they financially affordable? I mean, can most businesses could probably afford that?
Yeah.
Okay.
Yeah. They're usually a PEPM fee, so they pay per cost of employees on the plan. They range probably $1.50 to $2 on average, or even less per month.
Seriously?
Yeah.
Wow.
So there's a lot of different vendors out there. Some have more elaborate solutions online with tools and meditations and visualizations and things like that they can offer in addition to just the coaching sessions, but some are even more affordable. So I would also say survey your people. I mean, every organization and demographics are different of what the needs are. Do you have a population of mostly men in their 40s, 50s? They're going to definitely be interested in different resources than people that are in their 20s to 40s that are, unmarried or, just getting started with their families. Their needs are different. And so the solutions you put into place should be different. And I think just start somewhere, have maybe a calendar, and each month you focus on a little bit of different information. If it's, on stress management, you can send out an article, you bring in someone for a webinar, lunch and learn. What depends on your budget and, what bandwidth you have. I know a lot of organizations are running thin on the workforce right now, and they wear a lot of hats. And so it's very overwhelming to just do it all, but it's not a sprint. It's a marathon. It's a long-term strategy, and one thing is better than nothing. So I think even just addressing it with your organization, saying we support your mental health, and here's the things that we're doing, and try and add to those each
let us
quarter,
know how we can help you.
Yeah. Well, and it seems like if you could find something, so larger organizations maybe won't have, they have a different issue than the smaller organizations, like you said, in the smaller ones where you've got person who's the HR and the janitor and the CEO and all that stuff, right? And that'd be difficult for her to, kind of do all those things. But I don't think it has to be very complex either, right? Just simple information consistently, right? Even if it's, like you said, if it's just a once monthly email and you just find, and you link to something and say, here's something on stress management. You could literally do a Google search that would take you about 10 seconds and find something about stress management in the workplace. You could send out that email and say, hey, here's an email on stress management. Here's the link to our EAP information. And that's it, right? And then employees start to realize every month they're going to get that email. And then when they're in crisis, they don't have to go look back 6 years when they got hired, right? Dig through their files and find that out. They can just go back a month and say, oh yeah, because we're getting those regular emails.
Yeah. And I, work for a health insurance company, and my sole role is to help our employers utilize their benefits they're paying for already.
Right.
So you probably have access to someone like that works for your insurance carrier or at the brokerage office that is a dedicated wellness consultant that can at least guide you into what free benefits you have available, how to access them. And I put together a monthly newsletter for our clients. You probably have that available as well, so you're not even having to do the work. If you're not, I'm sure that you could get on a distribution list of other wellness vendors, and they would send that information out, so you're not having to recreate it. But tap into your insurance carrier and to your brokerage office, because I can assure you one of them will provide you with some great resources.
Right. Well, and it's to their advantage as well. The insurance providers, that's money well spent, right? In promoting wellness and short-circuiting a problem before it happens. It's much, much less expensive to deal with a problem before it happens than to deal with it after it happens. So even if you took all the altruism out of it and said, we just want to be a healthier, happier people, just dollars and cents, it makes better sense to prevent than to cure.
Exactly. And with the prevention ability with your insurance, now you have access to a lot of great preventive screenings, immunizations. You have, mammograms, colonoscopy screenings, prostate exams. All of those are covered at 100% for most organizations through the the Affordable Care Act. Right. And so take advantage of those at the very minimum. Get a cholesterol panel done. Just know your numbers and kind of get a baseline.
It'd be awesome if there was, because all of those preventative services are now free, but like everything you just mentioned was regarding physical health.
Right.
And that's what we think about. Wouldn't it be great if we had a menu of like of mental health prevention services as well that were also, that were also just covered by, the same sort of thing.
Mm-hmm. We'll get there in about 50 years. Right?
Yeah, exactly. The wheels turn slowly, don't they? Yeah. But talking about it and becoming aware of it is so important. And so for me, that's my biggest takeaway from today among so many, but just most businesses out there probably are already paying for a service that they are utilizing very, very minimally, and take advantage of that. Go to them and say, I want everything that I am paying for. I want all the things. And then communicate that to your employees. Make sure they are aware of those services available so that when the difficulty strikes, they, it just takes them a few minutes to figure out where to go.
Exactly.
Yeah. Great. Yeah. Thank you so much for coming today. You two were delightful, and I appreciate your expertise and your commitment to promoting mental health. It is, I don't know. I would expect in 50 years as well that mental health is going to be as big an issue as it ever has been. I think things are shifting more emotionally. Those are things we struggle with more often than even our physical health. So anyway.
Yeah.
Well, thanks.
We would love to invite you to attend events that we do put on to help.
Yes.
If you're looking for tools and resources, you can join our newsletter. And we educate about those upcoming events and do speak about mental health, burnout, employee engagement, social connectedness, so many great topics.
So where's the website they go to get that info?
UtahWorksiteWellness.org.
UtahWorksiteWellness.org. All your information there.
Yep.
Awesome. Kari and Heidi, thank you so much again for coming in and sharing information today. Thanks to all you for listening as well. Remember that change starts with you, and together we can increase our mental health momentum.